Straightening teeth is easy, but we want to take it to the next level and keep them straight for life. We're interested in getting to the source of the problem, not just putting a band-aid over the symptoms. I began doing orthodontics over 20 years ago because patients would come to me with headaches, popping jaw joints, and had difficulty sleeping at night. And many of them had straight teeth. What I thought was interesting was that many of these patients had had teeth removed because they were told that their jaws were too small. Oftentimes during a consultation, a parent would hear that their child had too many teeth for the size of the jaw, or that their teeth were too big for their jaw. And what was the solution? Extract the teeth to fit the jaws and make them straight? Well, what are the consequences then? For the longest time, mainstream dentistry and orthodontics had not made a connection between bicuspid removal and the symptoms of headaches, jaw popping, and sleep apnea. Have you ever asked yourself, what are the consequences of removing teeth? What happens to your jaw joints, your airway, and your facial muscles? And what about the tongue? It's got no room. Sure, you've got straight teeth, but now you have a narrow arch, and your smile isn't as wide as it should be. I treat my patients like I would my own family. The quality of their life is one of my top priorities. What's the youngest patient I've begun orthodontic treatment on? 2.5. And the oldest? Over 65. I find parents are more receptive to early treatment. If you can solve problems early on, you can take advantage of your child's growth and development before complications become more serious. We want to help you avoid more complicated and expensive treatment. Your child will have straight teeth and results that will last a lifetime. We want your child to reach their full genetic potential. And what does full genetic potential really mean? Not just straight teeth. I want your child to have big, beautiful arches. I want your child to have full lips. It's important to me that your child has healthy joints. I want your child to have open airways so they won't have to worry about sleep apnea when they're an adult. When it comes down to it, I want all of my patients to have beautiful faces. I want your child to have an outstanding profile and thereby feeling very confident in their life. It is ultimately your decision, but it is our responsibility to inform you